Hello and welcome to Lab Profit. India fights obesity. I have someone who is trained bariatric surgeons, one of the first and few in India to actually specialize in bariatric surgery. It's an immense pleasure for me to invite Dr. H.V. Shivaram from Aster CMI, Bengaluru. Doctor, thank you so much for joining us today.
Thank you. Thank you so much.
Doctor, in your rich experience of treating patients with obesity, let me understand the comorbidities that resolve once a bariatric surgery has been performed, not just weight loss alone, which is visible, which we see, what disappears.
Obesity is a mother of many diseases. It can be diabetes, it can be hypertension, cardiovascular problem, sleep apnea, infertility, or the cosmetic results of this. And people living with so much of weight who have not able to do anything on their own, they are dependent on others, and their life transforms after obesity surgery is done, and their life is much better and also comfortable.
Super. So it's a 10 on 10. All the lifestyle diseases disappear. The 10 probably dreaded ones disappear with bariatric surgery. Thank you, doctor. Also, let me understand this. When it comes to taking care of patients undergoing surgeries, especially we're looking at the year 2020 and we're looking at the pre-surgery phase where you're counseling, where you're telling the patient what's going to happen. The decision making is happening at that point in time. Right. What do you foresee? What are the initiatives that you see?
Yeah, the most important thing what these patients should do is the lifestyle changes. If they are eating wrong, they should correct it. If they are not exercising, they should start doing exercises. Just surgery is a tool, and to make it successful, most important is the lifestyle changes and the way live, and they should live healthy. That's where is our focus.
Fabulous. Now, those who have undergone this surgery also see a phenomenal transformation in the quality of life. Many of the patients that you've treated, I'm sure, will be sharing the joy with you. Yeah. Any such incidents that you'd want to share with us?
There are so many patients who their life has transformed.
A new beginning, a new chapter, thanks to bariatric surgery. Doctor, let me also understand, post-surgery care is not as simple as it is for other surgeries perhaps. It's much more in detail and comprehensive when it comes to bariatric surgery. Can you tell us more about that?
Absolutely. This is one thing every patient who undergoes or planning for bariatric surgery should understand prior to surgery itself, that after surgery they have a new life. I tell them that now your life starts. You forget about your old life, start a new life, because your diet is different. You have to take multivitamins, calcium lifelong, and probably you have come every support group meeting or follow-up is a very important step which they have to do. They have to take multivitamins, calcium, check their blood tests every 6 months so that there is no nutritional deficiency. The success of this surgery, and also tell the patient that this is where our relationship begins with you, and it is going to go lifelong. So in other surgeries, after the surgery, patients can forget the doctor or the treating physician. But here, their relationship starts, which is going to go lifelong. That's why we have that WhatsApp group with the patients who have already undergone surgery, and they have to continue to be in touch with their bariatric surgeon.
Right.
Very important.
Sorry about that, doctor. Talking about post-op care, any initiatives that your center is doing at this point that you'd like to share?
Yeah, we do a lot of educational activities, and also to bring, now the patients are getting operated all over the world or sometimes in other centers also. We tell all of them, you come and we are going to care for you. When you come, they may get anywhere operated somewhere else also. So they can come to our post-operative, post-surgery follow-up, or the support group meetings, or the education initiatives we take, and we conduct a lot of like marathon or the shows, all these things, so that they also get motivated to remain healthy and happy in life.
All right, motivation is the key word here. Absolutely. But very happy, doctor, to have you join us here today on a fight against obesity. Very happy to have you here, but your message to all those who are watching, your call out, your action word that people should follow.
See, obesity is a disease. Unfortunately, we are not realizing that if the obesity is treated, so many other diseases can be simultaneously treated. There is no other surgery in the world. With one surgery you treat maybe 20 or 30 other diseases, and this surgery is very safe nowadays with the good centers, with a good surgeon. So not to worry, if there is a problem, there is a solution, and definitely you can undergo and transform your life with bariatric surgery.
Another great support that has come from IRD, for the whole movement of India Fights Obesity is looking at complete insurance. Your thoughts on that, doctor?
Yeah, this is a very good development which has occurred. All of us fought for this, either the supportive things or association, everything. With this, what has happened is the obesity has come to a disease level. That means everybody, even the central government has recognized, and now the IRDA also has recognized. So obesity is a disease. So once there is a disease, there is a solution. So patients should approach the doctor for this disease called obesity, and they can be treated. And because of insurance, I am sure a lot of patients will not now hesitate to come and get treatment for this, whether it is surgery or the other modes of therapy. That's a very good development which has occurred.
Thank you so much, doctor, and thank you for being part of this movement of India Fights Obesity. We're happy to have you here today once again. Thank you so very much.
Thank you. Thank you.